Good morning. I'm Dr. Greenky from Syracuse Orthopedic Specialists. I specialize in joint replacement surgery of the hip and knee. I grew up in Buffalo, New York, just down Route 90 from Syracuse. I went to, obviously, high school there, college at Northwestern University in Evanston, Illinois, outside of Chicago. Both my brother Seth and I went there on wrestling scholarships. And then I went to Long Island University in Columbia for a master's degree. And then actually came back to Syracuse for medical school. We did our residencies here, general surgery internships here, and I slipped away to Boston for a fellowship before coming back to Syracuse. You know, most patients I sort of think of as somebody in my family that I want to take care of, and so make them better with the least investment that they have to put in, and the most user-friendly treatment possible. So we want to make them better in a cost-effective way, in an easy way, and fortunately in orthopedics we have a lot of treatments that work well. When I was in college, I had an injury to my knee in my junior year that sidelined me just for about a month, and ended up with a couple knee operations after that, and realized that treatment really worked well, and I got back to a high level of sports competition really quickly, and it was very physical, the treatment. So I understood it well. It sort of resonated with the way my life was at the time, and so I thought this is a really good thing. So I went to medical school so I could be an orthopedic surgeon. Well, in joint replacement, almost everybody gets better. It's a really satisfying part of orthopedics. So, you know, we have 95% success rate or higher for our operations. So it's a really satisfying area to go into because you almost always win the game. And so it's really nice to play in a game that you almost always win. SOS was a merger of a bunch of smaller orthopedic practices in the late 90s. Actually, Dr. Perry Cook and I had about 5 or 6 meetings at his house. We sort of planned out a merger of the 3 major hospital-based orthopedic groups. So SOS was a brainchild of Dr. Cook and a little bit myself at the time, and it's come together nicely. You know, the way medicine has evolved, becoming more a corporate structure, we were forced to have a big practice in order to provide services to all our patients, like MRI scanning in a surgery center, that weren't possible for a small group. Well, there's new technologies all the time, and you know, one of the challenges in any subspecialty of medicine is figuring out which new things are good and which ones are junk and are going to end up on the side of the road and not be really standard treatments. So both Seth, my brother, and I have been working in total joint replacement for almost 30 years. So we're helping to advance some of the techniques of doing the operation in more less invasive ways, and ways that have quicker recoveries, and we're also working on improving the longevity and durability of some of the implants. One of my major interests is the partial knee replacement, which has been popular recently, the last 5 or 6 years, but we've been doing them for 30 years and working on improving the techniques. And so that's something that is, we were one of the few people interested at the beginning, and now it's very popular, so we have a lot of experience with that. So the new surgery center is a $16 million investment. We're making it upgrading our present surgery center to a new location. As the techniques in surgery become more efficient, joint replacement and some spine surgery is really becoming an outpatient operation for healthy patients. Outpatient surgery is safer, the risk of infections very much lower, and the ability for us to control everything in an operating room is very attractive, because we can perform and deliver a higher level of service. And it's much more cost efficient, with 25 to 40% reduction in the total cost to whoever pays the bill for the insurance. So that, and most people's companies, employers are paying the bill along with the patient, and so we want to offer value. So Operation Walk started about 20 years ago. A surgeon, Larry Dorr in California, who wanted to sort of give back to the world, started a foundation in which a team, like a MASH unit, goes to a foreign land and provides free joint replacements to patients that wouldn't have access to that kind of technology. Basically, every year we have a fundraiser and we donate money and we go to a foreign land. So we bring everything we need with us, which is about 5 tons of cargo and 45 to 50 people, including the surgeons and the nurses and the anesthesia techs and the physical therapists and the floor nurses and an engineer in case something breaks. And we go somewhere and we do between 50 and 100 joint replacements on patients, and then we come back. So we've been to Nepal, which is really far away. I say that if you miss your stop, you're on your way back, because it's the other side of the world. And Panama City, Guatemala, and Ghana. And this year, in November, we're doing our 9th trip, so that it's almost a decade. Well, I'm a family man, so I hang out with my 3 kids, all of which have moved away, so that's a little trouble right now. But my wife and I like exercising. We go jogging and biking. We have a little camp on the lake, so we enjoy the summers outside. So when it's not snowing and it's not raining, I want to be outside, either in the garden or going for a jog, or I read books and hang out with my wife. Those are my favorite things to do. Syracuse is a great place to raise a family. Everyone's friendly. Everybody knows each other. It's a big, small town. And so it's a really great place to grow up and have a family and be able to sort of see them a lot. We get mad when there's a traffic jam and we're home 5 minutes later than we want it to be. We're totally spoiled that way, which is really nice. Upstate New York is gorgeous, and other than the proportions of the seasons, it's a fabulous place to be. So, I grew up along Route 90. I went to college along Route 90. I went to medical school back here, and then Boston's on Route 90. So I have to go north-south a little bit more, I think.